Thank you, ma'am. Lion's Prayer. When I attend my Lion's Club and break bread at the table, I give a million thanks to God to know that I'm able to live there with my fellow man, relax and play and sing, to hear the speakers of the day and the fine thoughts that they bring. I realize that I have a part in caring for the blind, also the underprivileged. Let's keep them all in mind. Now, as we do our daily tasks, pray God we do them greatly. Then liberty and intelligence will be our nation's safety. Amen. Thank you, ma'am.
While Lan Rotime is always there for us, when we make mistakes, he will always tell us in private. So thank you. My IBDG sir, programs we have the invocations. I want to believe that we have the Lions Code of Ethics and Lions and the Lions purpose. Do we have it? Who will read it? Do you have it?
Yes, everybody's been given. They know. Yes.
To honor.
Thank you. Good afternoon, everyone. Please, I want to correct my names. My name is Lion Grace Nene Osunwa. Thank you. At exactly 1:36, I want to call this event to start to order.
Thank you very much.
Zone 2A Chairperson, Lions International Purpose, to organize, charter and supervise service clubs to be known as Lions Club, to coordinate the activities and standardize the administration of Lions Club, to create and foster a spirit of understanding among the peoples of the world, to promote the principles of good government and good citizenship, to take an active interest in the civil, cultural and moral welfare of the community, to unite the clubs in the bonds of friendship, good fellowship and mutual understanding, to provide a forum for the open discussion of all matters of public interest, provided, however, that partisan politics and sectarian religion shall not be debated by club members, to encourage service-minded people to serve their community without personal financial reward, and to encourage efficiency, promote high ethical standards and commerce. In commerce, industry, profession, public work and private endeavors, Lions International Purpose.
I am Lion Tessia Lajakale, past region chair, president of Lagos Lions Club. I take the Lions Code of Ethics to show my faith in the worthiness of my vocation, my industrious application to the end, and I may merit a reputation for quality of service, to seek success and to demand all fair remuneration or profit at my least due, but to accept no profit or success at the price of my own self-respect, lost because of unfair advantage taken or because of questionable acts on my part. To remember that in building up my business, it is not necessary to tear down others, to be loyal to my clients or customers and true to myself. Whenever a doubt arises as to the right or ethics of my position or action towards others, to resolve such doubt against myself. To hold friendship as an end and not a means. To hold that true friendship exists not on account of the service performed by one to another, but that true friendship demands nothing but accept service in the spirit in which it is given. Always to bear in
Stella Busari to give us her welcome address.
Bear with me. I'm so happy to see you all seated happily in your Ijebode caps and your golden shirts to mark today, because today is Childhood Cancer. I beg your pardon. The 15th of February was Childhood Cancer Day, and they mark the color for the day is gold. So I'm happy that we're all dressed in gold to honor them for this occasion. Thank you very much. My most senior lions, I greet you, sir. My president, my doctor. I know you're angry with the smile soon. I welcome you all. I want to say thank you to the media too for being here, and the Leos. Yeah. Like we all know, the International Childhood Cancer Day was celebrated worldwide on the 15th of February 2024. And we at Ikoyi Lions Club chose to show love to our children with cancer. I would like to recognize Dr. Nneka Amobi and her NGO, Children Living with Cancer Foundation, for their advocacy on the fight against cancer in children. We are very proud to partner with you today. Thank you very much. So the parents, I say you are doing well, an amazing job, and I say sorry for the struggle you face every day. You are handling this with so much strength and courage, and I say your children are very lucky to have you. Wishing you healing in all sides. To the matron of the ward and the workers in the hospital, I say may you be rewarded. Well done. I thank and appreciate all lions and friends who are present, and many who are not here but donated handsomely to the success of this program. We're going to sit back and relax and hear the speakers of the day, the fine thoughts that they bring. I believe that at the end of the day, we will go home with knowledge on how to battle with childhood cancer. Thank you very much for coming.
At this junction, the most senior lion in Ikoyi Lions Club as of today is the president. And we want to
Another doctor here who is also a presenter. Can we have him to the high table?
You are looking for a man. You are looking for a man.
Where's the doctor?
That's the doctor.
My donkey.
Doctor, you're welcome. Thank you so much. At this point, we have identified this month as the month for cancer, and we have been here and we have spoken with the center. We have identified certain items that would put smiles on the faces of the cancer children. The main reason why we are here. But the talk is for us to take home something, awareness. My chairperson has said it all, so because we have also wasted time, I would say we should just take a start. Thank you so much.
We thank you and we appreciate you. God will reward you. I will want to.
Thank you much, sir, for the welcome. Thank you, everyone. Okay, so today I'll just be talking about an overview of childhood cancer. I hope I'm being heard. Okay. All right. So what is cancer? Cancer is actually the abnormal cells. All our body is made up of cells. So the abnormal cells, they are growing, and then as these abnormal cells are growing, they're actually cancer because they have the capacity to affect other cells. We call it metastasis. As they are growing, they are forming new cells, and they are affecting every other cell in the body. That's why they are called cancer. Instead of these cells to be dying, okay, they continue to grow, they continue to form new cells, and then they continue to affect every other cells in the body. Okay, so These cells, they go out of control. They are fast growing. Some of the cells, they can be slow growing. But in children, cancer cells are fast growing, and then they just begin to grow abnormally. In most cases, these cancer cells in the body causing havoc. So how is this childhood cancer? How is it different from an adult cancer? Childhood cancer is different from an adult cancer because it is fast growing, unlike an adult cancer. It is fast growing, and it is different because there is a change in the DNA of those children. So it could be maybe when they are born, early hours of life, or even in utero when they are still in the womb. So these abnormal cells, there's just a change in the DNA, and they begin to grow abnormally, as opposed to an adult whereby there is an environmental risk, maybe environmental risk like alcohol, smoking, radiation. It's not like that in children. In children, once the insult is there, there's a change in DNA, nobody knows why, and they begin to grow abnormally, and as cancer cells. Okay, so childhood cancer types, there are 3 broad classes. Okay, so it could affect the brain, the CNS, the central nervous system. There's a cancer of the brain in children. It could also affect the blood and the lymph nodes, the leukemias, the lymphomas. And there could also be a solid cancer. Solid cancer meaning these are abnormal cells that are growing and they are forming tumors. So there are different forms of solid tumors in these children. It could be the eye, which we call retinoblastoma. It could be the kidneys, which we call the Wilms tumor. It could be the liver, which we call hepatoblastoma. So depending on the organ, okay, depending on the organ that is affected, they will form a tumor around that organ, and it's not very good. So depending on the type of organ that is being affected, we call the name of the cancer based on the organ. If it's a CNS brain tumor, if it's blood, leukemia. If it's the kidney, call it nephroblastoma or Wilms tumor. And so it is very important to identify the type of cancer the child has, so that we know how to treat them. Because identifying the type of cancer tells us, okay, what treatment modality we'll use to treat these children. Is not known. It's just an abnormal cell, DNA change. As opposed to adults, that in adults, environmental factor can say, okay, we'll stop smoking, stop drinking, and all that. But in children, it just happens. So it's really not preventable. But there are some cancers that could be secondary. For example, now exposure to radiation. And how do we expose these children to radiation? They must have a primary cancer. For example, now a child has a retinoblastoma. We say go for radiation therapy, which is part of the treatment modality. And the child gets a secondary cancer. So prevention, we go for surgery. Like children that have a nephroblastoma, a kidney cancer, they have 2 kidneys. They will quickly bring out one of the kidney adults because these cancers are very fast growing cancers and they are very sensitive to chemotherapy. 90% success rate in helping in reducing morbidity and mortality that is associated with these cancers. To actually will help in reducing the mortality and improving the survival rate of these children. So everybody is involved. Nursing, oncologists, nurses that are involved in seeing these cancer patients, the psychologists. Because imagine a child coming down with cancer. Chemotherapy has side effects, both immediate side effects and long-term side effects. And palliative and part of the multidisciplinary care, we call them immediately to counsel the children, the mother, as to how we are going to manage them. We call the surgeons because they are also mostly involved depending on the kind of cancer they have. Even the radio oncologists, because radiation therapy is also part of the treatment modalities. And then also we have wonderful NGOs like Lions Club that have been very awesome in helping, putting smiles in the, putting smiles in the face of these parents, because sometimes we have challenges, financial constraints, managing a children with cancer, it's a burden. There's a lot of financial burden associated with managing a child with cancer. And some of these parents, they've even given up even before treatment started because of finance. Lions Club have been doing great because there is this fund that goes into Friends of Pediatrics. We easily, fall back on these funds, helping these children, and before you know it, we are getting good response. So this NGO, Lions Club, they're also part of treatments, modalities for this cancer. And I must really say thank you so much, Lions Club, for so much. God bless you. Thank you very much.
Even with Cancer Foundation, I can tell you, you need to clap because she is doing what Lions are doing in a particular sector. Oh, please clap for her, madam.
Thank you very much. I'm very happy to welcome the Lions Club Ikoyi to Alimata Oncology Center, Lutz. Thank you so much for coming. I've known that for the past, I think 3-4 years, pediatric oncology has been one of the things that Lions Club has been into. And I will say that in that 3-4 years, we felt the Lions presence, not only with children living with Cancer Foundation, but also in the hospital where we were before we came to Alimata. Their presence was well felt. Lions Club, Apex Club, I think Maryland, they were very, very key in things that they have been doing. So I'm very happy to welcome you all. Now, children, Dr. Adeyemo have spoken quite a lot about childhood cancers. But you see, she talked like a doctor. Now, I'm going to talk like a parent, a mother, and also somebody who have been with these children for the past 20-21 years. We started Children Living with Cancer Foundation about 21 years ago, and it has been an uphill task. And I was here thank the health workers, especially the matrons, the nurses in this ward or in these our wards, because I say something to most people. The doctor will come and give instructions and go, but it is the matrons, the nurses, that and then the parents, the mothers especially, who are there. They are the ones who see, they are the ones who witness every single thing that is going on with our children. And I will say to the parents and to the doctors, when the parent is not a very good doctor, because the parent is the first doctor that child knows. The parent is the first nurse that child knows. The first driver, the first everything, So when a parent comes to give, let's say chemotherapy or do some procedure, and that parent is saying, no, I advise the doctor to leave that child alone. At the very most, speak with the nurses on duty, because they know the child that is ready for chemotherapy. They know the child that is not ready for chemotherapy. I have parents who would not bring their children in at the time that they should come to receive their treatment, because they feel that something is wrong. One of the things that Dr. Adeyemo didn't say was that for every treatment that is given here, we do like baseline investigations, because processes are okay. If you have not done that, you cannot give any child any medicine, no matter how urgent that treatment may be, because that is the most urgent treatment that child needs. That topping up is the most urgent treatment that the child needs. Now, coming back to Children Living with Cancer Foundation, like I said, we started about 21 years ago. And when we started, it was basically because, one, there were no charities for childhood cancers in Nigeria. So we were the first to come on board. Not only that, we saw that most parents that we come across were parents who were not very affluent, one. And then when you think about it, we are dealing with little children, which means that their parents are not that financially buoyant. They are just starting life mostly. So no life saving, so to speak. They are basically maybe 9 to 5 workers. There's only very few that you see that that would have trust fund or grandparents that have money that would support the treatment. And so there was a need.
Cancer. How can a child have cancer? Cancer is something that we call in old people. Let me tell the story of why I have interest in cancer. I said it when I did my inaugural lecture. When you are in preclinical, they tell you a lot of things, a lot of diseases. You don't believe a lot of them. And as far as I was concerned, when I was having cancer, I thought cancer was going to happen. It's happening in old people. Never paid attention. The first 3 months in clinical medicine, when you crawl to seeing live patients, the very first person they gave me was a 25-year-old man with colon cancer. My head scattered. 25-year-old. I thought they say people who are old and won't have cancer. That's what about two. That colon cancer don't occur in us because we eat a lot of vegetables and we go to toilet frequently. We don't are not going to toilet. How can this 25-year-old have cancer? They operated. One morning we are being walked down. We just left him. He said, okay, maybe he's free to go home. And suddenly they called us back. He was gasping. Before we knew it, he died. That morning, in fact, I didn't know, everything scattered in my head. Suddenly, I started having what we call medical student syndrome. Medical student syndrome is when you assume the signs and symptoms of a patient that you have it when you don't have it. And that's how I started going from clinic to clinic. You see, I think I have colon cancer. It was and I was being stressed. That the second way, this is medical student syndrome. You don't have colon cancer. But when you get that, one needs psychological assistance. I never got any. I had to heal over 3 months. Thinking about it. So this cancer will occur in young people. Not only young people. In a center here, we have had 3-year-old with colon cancer. 3-year-old with colon cancer. As we grow older, the number of cancer that we have and the frequency grow older. For example, we men, prostate cancer is a problem. As we are growing older, prostate cancer will occur. In fact, it's good that if a man grows old enough, go and check his prostate, you will find cancer there. So as he's growing older, the man will develop prostate cancer. It is almost as certain as the age of the man. And that's why every man, I was telling you yesterday that they should come and get my prostate out, but I want it out. They say very fast. As if they are growing as fast as, in fact, more than the body is growing. You see a baby that they say have cancer, because of the small swelling two weeks ago, you will see it sometimes as big as the head of the baby. So they grow very fast. Total differentiation. As we have names are different, so is our cells in our body. We don't have the machine here. CD4. Eventually now, because we are preparing for bone marrow transplant, Chevron have donated one for us. We've installed it to now read the machine, to read the bone marrow transplant, but it's not to diagnose cancer. That machine is needed to help us diagnose cancer. The other thing that happens is that is functioning well. So it makes us to give them high dose of chemotherapy that can wipe out their cancer. Number two, because their cancer is growing very fast, it also responds very fast to chemotherapy. A mom and a leg have to sell the family property for cure, and we need help. They say they have something they call health insurance in Nigeria. The health insurance we have in Nigeria is a stealing health insurance. I went to get an X-ray. They said the health insurance does not cover all. Now the health insurance only pay for 1,700 out of 8,000 I want to pay, so I have to pay the rest. That is not health. That is stealing from the people.
How we can prevent them through medical massage therapies.
We are very good and this partnership, I believe that we Lions Club will make it an enduring partnership. We thank you very much. I'm sure somebody will be admiring you one day and will be recovering. Very this thing. So congratulations.
Prof, sir. Prof.
You are distracting, Prof.
I want that.
She was? No, you cannot watch her. That's a lion. Always a lion. In lion, we stand the war. In lion, we stand the nation. In lion,
And Lionism together. I know this is a donation from Lagos Ikoyi Lions Club, but it's also a donation from District 404 and it's also a donation from multiple District 404 Nigeria. So on behalf of the President and on behalf of our District Governor, on behalf of all the Lion leaders, and on behalf of all the Lions of Lagos Ikoyi Lions Club, we want to make these donations by Limata Okoroji. Because Lions may not necessarily be doctors, our job is to provide succor to the patients and their parents. Lions Club. We hereby make these donations to you and the Children Living with Cancer Foundation. Thank you very much.
So,
before I sign off, I'd like to say that the young girl whose leg has been cut off, when you're looking for money to buy the artificial leg, I'd like to make a donation of 100,000.
We have 150 on behalf of that young girl whose leg was cut off because they said they want to buy what looks like a normal leg. It's going.
A very big thank you for all the support that we have been having from you for the past maybe 4 or 5 years. Lions has been a partner with us from when we were on the other side.
Even when we came back, when we came here, they have not relented in their effort. I want to say we are on the field working, but Lions too, you know, have been a source of inspirations to us because they made our job easier. When we are in need of anything, or as individual, they come to be a succor to our patients. So on behalf of our patients and all the staff of Halima Atta Pediatric Oncology, I want to